Syphilis is a bacterial sexually transmitted infection which is called STI caused by Treponema pallidum, which result in substantial morbidity and mortality, and it's curable. Syphilis is transmitted through sexual contact with the infectious lesion via blood transfusion or from a pregnant woman to her fetus.
There are four stages of syphilis, which are primary, secondary, latent, and tertiary. During the primary stage of syphilis, you might spot a single itch or several. The pain marks the spot on your body where syphilis occurs. The sores typically develop in on or near the reproductive organ and lips or in the mouth. Second is secondary stage. Cold rash pain to brown macules, ocular syphilis manifestations, oral lesions, genital inguinal rashes, symptomatic early neurosyphilis, and less common internal organ manifestations.
Latent stage, also referred to as the late hidden or sleeping stage. Even without treatment, it could appear normal and continue to develop in the body and progress to next stage in a matter of months or years. For tertiary stage, including tabes dorsalis, gait impairment, and dementia, tabes dorsalis damage the dorsal column and sensory nerve roots, causing a syndrome of pain and sensory deficit. Gamma are ulcerating granulomas on skin, bone, and internal organ, while for cardiovascular, effect of tertiary stage includes aorta, aneurysm, and coronary arteritis.
Causes of syphilis. Syphilis spreads from person to person by direct contact with a syphilitic sore. Syphilis can spread during vaginal, anal, or oral sex. Pregnant people with a syphilis also can transmit the infection to their unborn child.
You face an increased risk of acquiring syphilis if you Number 1 is engage in unprotected sex. Number 2 is have sex with multiple partners. Next is are a man who has sex with men. The last one is are infected with HIV, the virus that causes AIDS.
Primary stage symptoms can characterized by chancre or syphilitic sore. That chancre resolves within 3 to 6 weeks. The other symptom is lymphadenopathy. Move to secondary stage symptom that usually begin with a rash on area of the body. The other symptom is alopecia, sore throat, fever, headache, swollen lymph node.
Following the secondary stage is the latent phase that may last for years, during which time the bacteria remain dormant and there are no symptoms, but tests for syphilis are positive. This stage is generally not contagious, but lesion may sometimes appear on the skin, and the direct contact with this lesion can transmit the disease. For tertiary, syphilis develop in about a quarter of untreated cases. After the original infection, there are three major forms. There are goma, cardiovascular, and neurological disease. In this stage, the disease can damage the internal organ including brain, nerve, eyes, and others.
A single injection of long-acting benzathine penicillin G can cure the early stage of syphilis. This includes primary, secondary, or early latent syphilis. CDC recommends 3 doses of long-acting benzathine penicillin G at weekly intervals for late latent syphilis or latent syphilis of unknown duration.
After the treatment, you should abstain from sexual contact until your treatment is complete and blood tests have confirmed that the infection is cured. Your doctor may also recommend that you be tested for HIV, since having syphilis puts you at increased risk for this infection. If you are allergic to penicillin, your doctor will suggest another antibiotic. But penicillin is the only recommended treatment for pregnant women with syphilis. There are no home remedies to cure syphilis.
Prevention of syphilis. 1. Syphilis test. 2. Avoid recreational drugs. 3. Have mutual monogamous sex. And the last one is 4. Use a condom.